Hey guys, so this is a video on what to expect when you're getting an NG nasogastric feeding tube placed. This is just my experience. I'm looking down because I've written notes. So basically, I have my feeding tube due to Crohn's disease, just want to put that out there. You sit upright in the hospital bed, and you kind of just like sit normally. You choose which nostril. I chose this nostril, and I'll explain why it's in this nostril in a minute. So a nurse will do it, just a random nurse. I got to choose which nurse I wanted because to make me feel more comfortable. If you can hear that noise, it is my feeding pump. So please excuse that. So the nurse will have, wash your hands, get all the equipment ready, get all the gloves ready, get the tube and put a bit of lubricant jelly on the end of it to obviously make it slide down your throat more easier. So basically my nurse started pushing, well, it was this nose, so she was slowly pushing it into my nose, and it gets to the point where your nose connects to your mouth, your throat, and that's the point where it feels the worst, and it kind of it's hard to get through at that point because I don't know, it kind of bends down, I don't know, it kind of curves, maybe, I'm not sure, but that is the point where it's quite painful and feels really uncomfortable, and it can kind of get stuck, and not get stuck, but it kind of just won't go down because it's difficult. And that's what happened to me. It would not go down. And you have a cup of water with a straw, and when she says swallow, you will swallow and sip and swallow and sip, just keep swallowing, because obviously then you're swallowing the tube down into your stomach. And it just wouldn't go down, and it was painful, and I was crying, and I was like, I wasn't crying because it wasn't that painful, but I was crying because it's not a very nice experience, I'll tell you that. It's not very, pleasant. It's awkward, and it is discomforting. Yeah, it is really. And I was crying because obviously the discomfort, and because I just felt like I was doing something wrong. I was like, what am I doing? Am I drinking? Am I doing it right? Should I do this? And they were like, calm down, just calm down. So she tried again, and she took it out. She got more jelly on it and stuff, and I was sobbing, and my nose was running and full of jelly. So she got more jelly on it and tried again on this nostril, and it wouldn't go down. And it kind of got me stressed out because I was obviously under a lot of stress anyway, because you're getting a tube placed on your nose. So she got another nurse, she got the sister of the ward to come and help, and then the sister tried this nostril. So the sister was pushing it up and twisting a little bit, and it sounds horrible, it sounds really, really, really painful, but it's not. It's just that point that right up where your throat and nose connect, that's the painful part, and then when it goes down it's not painful at all really, and it's not really that discomforting. It's just that point where it's you're swallowing it and it's hitting your gag reflex. That is the point where it's the most horrible. So she was slowly turning it, and it went down, and so I was really happy about that. And they taped it to my nose. They taped it with that big nose tape, and I did not like that, obviously. And then they aspirated it, which I have a whole video on aspirating and starting your feed if you want to check that out. So basically what aspirating is they put a syringe at the end and suck out your stomach acid to check if it's in your stomach, and then they test the pH of it to see if it's in your stomach, and that's pretty much it. You may have to have an x-ray to see if it's in your stomach or not, to see if it's actually in place. I didn't, because they aspirated it and the pH was correct and everything. So that was that was the placement. After the placement, it was horrible. It was horrible. I hated it. And like looking back, it wasn't that horrible, but at the time it was disgusting. My throat's still hurting now. My voice is really funny. It's really painful, and I have to take painkillers for it. And it's so painful to swallow still, and I've had my tube for 2 weeks now. No, 3 weeks, sorry, 3 weeks. And so it took me about 4 days to get used to the pain, and it's still painful now 3 weeks later. I don't know why. I think I need to like push it. I think I need to like push it and tape it better to my face. But it took me 4 days. The first 4 days were horrible. I hated it. I cried my eyes out the first day. I said I couldn't do it. I was that close to getting it taken out. But I thought, no, I've got to do this because I've got to like heal myself and recover from my Crohn's disease. I need to help myself. So I battled on through it, and 4 days, after 4 days, you kind of get used to it. It's still painful, and it's, you know, you can still feel it there, and people say they can't, but I personally can 3 weeks later, and it's very painful. But 4 days, and then you're kind of used to it. You don't feel like spewing or vomiting at all anymore. And when you first have it placed, you don't want to talk to anyone. You don't want to swallow your spit, so it would be good to like spit into a tissue or something. I know that's kind of gross maybe, but you don't want to drink at all. I stopped taking all my medication, like my pain medication, because I did not want to drink anything, and that's really bad, I know, but it does get easier. It just makes you feel like you're going to throw up all the time, and it's just really discomforting, but it does get easier, I promise. I've just got to battle through that first 4 days. It's roughly about 4 days. It might be sooner for some people. That, you know, everyone's different. You just got to remember that my experience, like looking back at the time, it was very distressing and very discomforting, but looking back now, I would do it again, and I would do it much more like easy. It would be so much easier because I know what's going on, and I know this video is probably scaring you if you're getting a tube placed, and it probably sounds horrible, but it really does get better, and it really will. You will be, you know, I don't know what to say. The tape can be itchy at times. I like itching it sometimes, but I tape, you know, I tape mine here and up here, because like when that falls down, it's like it rips the tape out sometimes. I need to tape it better. I know I don't tape it the best. I should tape it closer to my nose, and I probably should use the nose tape, but I don't like the way it looks because I don't know. And my tape is 3M. I think it's like, oh, I don't even, sorry my camera got cut off, but that's basically it really. It does get easier, it really does. It's very interesting to do things yourself, like doing the pH yourself and aspirating and filling up your pump and all that. It really does. I promise it gets better, and you just gotta battle on through the first couple of days. Thank you for watching. I'll try my best to answer any questions if you have any. This is my experience and kind of what to expect. It could be totally different for you. It could be walking the park. It could be much worse. But literally, there's nothing to worry about at all. It's just, it is discomforting. It's not the worst pain in the world, but afterwards, the placement is fine compared to what it feels like afterwards. After, like, you know, the first 4 days I keep mentioning. So yeah, I hope this helps, and I hope I haven't scared you, because I promise it's not that bad, and I'll try and answer any questions or anything if you have any. Everything's in the description box. And just want to mention quick, I'm not sure the name of my tube. It will be in the description, but it is in 8 French. I know that. That's all I remember. So try and ask for, well, not ask, but I don't know if you can ask, but maybe suggest getting an 8 French, because it is pretty thin. I think, I don't know if it's not, obviously probably not the thinnest one, but it is really thin and that will feel better. Plus one more thing, when they're inserting it, there's a wire in the tube, they pull the wire out and it feels a lot better when they pull it out. It's a guide like to make it stiff when it's getting placed, and then they pull the wire out. I forgot to mention that. Okay, thank you.